Hi guys, welcome back to my channel. In this video, I want to give you tips on how to succeed during your clinical rotations. First of all, congratulations on making it this far. I'm so proud of you and you should be proud of yourself too. So if you are interested in knowing tips on how to succeed during your clinical rotations, then keep on watching. And for those who are new, I hope that at the end of this video you will find a reason to subscribe to my channel so you can help me grow my channel. So thank you all for watching and let's get into the video. First off, always remember how much you're spending for your nursing education. I don't care if it's a scholarship, if your parents are paying for it, or if you're paying for it out of pocket or getting a loan. It's a lot of money. So you have to keep that at the back of your mind, and you always have to make the most of every opportunity that's given you. The nursing schools have placed you in your clinical rotation, so it's up to you to advocate for yourself so you can get the most out of this rotation. So um, when you're on the floor, let the nurses know or show them that you're ready to learn. Tell them what skills you have and what you're comfortable doing. A lot of nursing students I know were health aides or CNAs before going to nursing school. So if you're comfortable with, let's say, vital signs or getting a patient's weight, tell the nurse what skills you have and what you're comfortable doing. So when these opportunities show up, they are going to call you to help them. That way you can practice these skills more and get more comfortable doing the skills. You also have to let the nurses know what your goals are for that day, that week, that month, and the entire rotation. You want to tell them what you're hoping to get out of the rotation so they can know how to better help you to meet those goals. If for today you decide you want to see like a Foley catheter insertion, tell the nurse. So if they are doing one of these on their patients, they call you in so you can see this procedure done. And sometimes the nurses know if they don't have this procedure that day, they can always talk to their colleagues. Listen, I have this nursing student I'm working with. She really wants to see how a Foley is being inserted, and their colleague is going to call you in when they have the opportunity, even if you're not shadowing that nurse. So they know these things. These nurses have been students in the past, so they know the drill, but they're just waiting on you to show them that you are ready to learn, and then they're going to help you to learn as much as they can. You also want to do your homework before going for your clinical rotations. I'm not just talking about care plans. Yes, of course, you're going to have to do your care plans. That's a given. But you also want to learn about the disease processes that are commonly seen in the patients or among the patients that you'll be working with. So your school will normally tell you you have been assigned to this floor and these are the kind of patients you'll be seeing. So it's up to you to open your textbook, whatever you use, to read up on the common diseases that are seen on this floor. Say they're sending you to a GI floor. You can go now and learn or read up about ulcerative colitis and Crohn's disease. What are these diseases? How are they diagnosed? How are they managed? What medications are used? And you want to know the mechanism of action of these medications and what side effects to watch for. This is not just educating yourself. Yes, you're going to gain that knowledge, but it's also going to boost your confidence when you're working with these patients. Patients are going to ask you random questions. They are in a very vulnerable situation and they just want to know that they're going to be okay. So they're going to be asking you questions. They don't care that you're just a student. You're just a nursing student. They're just going to ask you questions about the diseases, what medications they are on. So you want to have that knowledge at the back of your mind. You want to have that already. So when they ask you, you know what to tell them, because you don't want a patient asking you and you're like, oh, I don't know. So what are you doing here? Like when you're a patient, you expect people taking care of you to know what they're doing. So when you go there already knowing what to say, it just makes everything easier for you. It builds your confidence again, and you just helps that relationship with your patients. Your patients can trust you more because you know what you're doing. Now, if you watched my previous video, or I think my two previous videos, I believe one of them I talked about what you would need for your clinical rotations. And I'm sure I mentioned a notebook or a clipboard, just something to write on. So during your clinical rotations, it's a good time for you to have this notebook or clipboard, whatever you choose to use. Have this in your pocket. So as you go about your day, if you see something interesting like a diagnosis or a procedure that maybe you don't know so much about, you can write that on your notebook or in your notebook. So when you get home, you can review, learn more about that diagnosis or medication. And also, you can always write down questions. When you're caring for the patient, you might have questions come up in mind, but you guys are so busy during that time, you don't want to interrupt the nurse's flow. Write the question down so when you guys finally have time to sit, you pull out your book and then ask the nurse that question. And even if you don't have time to ask the nurse the question, I know from my experience, we always had like what was it called? At the end of the shift, we always met with our nursing instructor. So if you don't have time to ask the nurse a question, this is gonna be a good time for you to ask your nursing instructor whatever question you have. Asking questions, be it to your nurses or your clinical instructor, just looks good on you. It shows them that you are ready to learn, you are making the most out of this opportunity that has been given you. So always have some questions to ask. I'm not saying just ask some dumb questions here and there. You should have thought about these questions and ask them before asking them to your nurse or your clinical instructor. During your clinical rotation, you're gonna have times where they'll have a code blue. So when a patient has a lethal arrhythmia or their heart stops working altogether, in times like that, even if that was your patient, try to step out of the room because a lot of people will be coming in there to save that patient's life. And unfortunately, you are not skilled enough to help during that time. So it will be best for you to step out of the room and give the other skilled or more experienced nurses and respiratory therapists, whoever is coming to help, give them room to help that patient. You can stand maybe at the window or something to see what they're doing, but you can't just be in the patient's face when they're trying to save that patient. You're just interrupting the flow. So step out and then let them do their job. Also remember to come with your nursing or clinical equipment, your stethoscope especially, maybe your pen light or whatever you normally take for your clinical rotations. You don't want to show up for clinicals without your stethoscope. How are you going to do your physical exam? How are you going to listen to the patient's heart, their lungs? So you want to come prepared with everything you're going to need. You don't want to have to excuse yourself out of the room to go ask for another patient, another nursing student's equipment to use during your physical exam. It already shows that you're not prepared and you're not ready to learn. So I would say pack up, have your backpack ready the night before so you have everything in the bag and just double check in the morning before you leave for your rotation. So you have everything together that you need so you don't find yourself in a situation where you're having to ask for someone else's equipment. Last but not least, try to go ahead of time for your clinical rotations. Say your rotation starts at 7 a.m. You can go for your rotation right on time. You want to go there 10-15 minutes ahead of time so you have time to put your stuff away, to gather your thoughts, gather your equipment, and then get your patient assignment and even have some time to read up a little bit on the patient before reports are given. Also, make sure you have the right attire. If they say white scrubs, have your white scrubs. If they say white tennis shoes with no marks, have them on. It's just gonna be for how many months and you're done with your rotation. I remember during, I believe it was my very first clinical rotation, and we were asked to wear plain white shoes, no marks on them. Here goes one nursing student showing up with black tennis shoes. Like, come on, it's simple. Wear plain white like it's asked. It's just for a few months and you're done. So stick to the rules, wear whatever they ask you to wear and show up on time. I know some nursing instructors will actually send you away if you come in late or if you're not properly dressed. Also, don't have colognes or perfumes that are too strong. Don't wear heavy makeup because you are there to work. You're not a model. So just dress nice. Take your bath that morning or your shower, whatever you have. Show up clean and ready to work. So that's all I had, and I hope that this was helpful. Thank you guys for watching, and thank you guys for continuing to watch my videos. Please don't forget to like this video, share with your friends, and also don't forget to subscribe to my channel. And until next time, bye bye.